My grandmother was the greatest storyteller that I ever knew. And today, in this moment, I bring her with me as an act of decolonization in this journey of health equity and leadership. I'll be telling you stories today of my leadership in the space of health equity, focusing on neurodiversity and autism. I want to talk about a young boy called Yasin. Yasin and his family moved to Edmonton, Alberta, Canada when he was 3 years old. They emigrated. Ayan, Yasin's mother, was curious about something that was going on with her son. She phoned her sisters back home and said, "My son is not growing like the others." Her sister said, "No, don't worry about it. Little boys take a little longer to grow. Little boys take a little longer to develop. He'll be fine." So she focused on making sure that she supported the extended family that she had brought with her, including an aging mother-in-law. With time, at about 5 years old, Yasin was still nonverbal and exhibiting great social anxiety. At that point, through community interactions and social workers, Yasin was eventually referred to the major referral hospital where he could get a diagnosis or an understanding of what was challenging for him. However, Ayan was told it would take 18 months until Yasin could actually see a physician who could talk to them about what the problem was. The family waited that 18-month period. Yasin eventually got a diagnosis 7 years old. The social system in Alberta kicks in approximately 6 months after you get a diagnosis. So at 7.5 years old is the first time that Yasin was able to interact and engage with a worker who understood his autism that he had been diagnosed with and support the family. Across town, I want to tell you a story about Tobias. Tobias was 2 years old. His mother, a university professor, and his father, a senior government worker. At about 2 years old, they also noticed that something was different about Tobias, and they decided to act immediately. They had the resources to hire a private speech therapist who was able to tell them that I see red flags for autism in your son. They immediately went to a pediatrician who was able to tell them the same process. We'll refer you to the major hospital that can give you a diagnosis, but there's an 18-month wait time. That family too then said, well, what can we do in the interim? They were told you could actually pay up to $4,500 to get a private diagnosis. Or alternatively, you can participate in a pilot study that is working to help pediatricians diagnose in office. They participated in that pilot and they received a diagnosis for autism for their son at 2.5 years old. Services for that boy immediately kicked in because of the part of town they were in. He received a diagnosis and immediately the early intervention started at 2.5 years old. What exactly is autism? Autism is a complex condition. It may involve persistent challenges in social interactions, speech, nonverbal communication, and sometimes restricted and repetitive behaviors. No two autistic people are alike. Autism manifests widely differently in any two people. Autism is typically evident around 2 to 3 years old, but it can be diagnosed as early as 18 months of age. We're not quite sure what causes autism, but it's a combination of genetic and environmental factors. We're not sure what the real reason is. What we do know, however, is that early intervention and early diagnosis is incredibly effective. In Alberta, as I said, it can take up to 18 months to receive a diagnosis. But diagnosis is key to understanding what is going on, key to equipping families with the skills and the ability to care for their loved one who has autism. And most importantly, it's key to receiving crucial funding to be able to support your loved one. I tell these two stories to show a glimpse into the intersection of factors that result in health inequities for families dealing with disabilities in general, but autism in particular. We live in a system with an abundance of healthcare, but we find ourselves with these two disparities in the same city and the same space. When we think of autistic peoples, globally, when the world thinks of autistic peoples, we visualize small little white boys, maybe with social challenges, maybe with delays, and these supernatural abilities to build blocks or structures that seem, contrary to our own imagination. We visualize young people who are with high IQs and the ability to be artistic and creative that is not neurotypical. Indeed, the data also tells us that young white boys are maybe what we call the avatar for autism. On average, it takes non-male and non-white children 4 times longer to get a diagnosis for autism, and therefore 4 times longer the opportunity for services. Anyone who doesn't fit in that description, that includes girl children, children of color, older children, youth and adults, then are skewed in the direction of poorer health outcomes as a result of delayed or no diagnoses. The more sinister flip side of this is that what does delayed diagnosis or no result mean? It's families seeking support from the health system in the wrong places, not getting the help that they need. It's over or under medication for the symptoms, maybe of irritability, of mood disorders, which are eventually ineffective. More broadly, it's problems in school. It's school exclusions. It's high overrepresentation in the mental health system. It's overrepresentation in the social justice system of autistic individuals. My leadership journey and equity journey has been characterized by responding. I respond to gaps that I see within my community, within society, and elsewhere. And I am called to leverage what I believe is my privilege to respond to those gaps. As a scientist with access to data, I have worked to build programs. I have worked to build programs that seek to help us understand the impact of delayed diagnosis, not on families, but on the health system as a whole. By exploring data for 20 years in Alberta, we're looking from the point of diagnosis before and after to understand how people are using the health system to try and respond to their need. By identifying the different healthcare professionals who are touched but may not understand how to then respond, we're able to develop the correct tools and the correct directionality. Most importantly, mapping actors of the entire ecosystem of care for autism within Alberta allows us to have an ecosystem community-focused approach. We're able to support communities with evidence-based and contextual intervention. Most exciting to me is my response as a healthcare entrepreneur. This is something I never thought I would be, but I've been pushed and challenged to respond in different ways. My business partner and I are responding by availing housing opportunities that are thoughtfully designed, sensory-friendly, and accessible for young adults with autism. Using the same skills of mapping actors and bringing together community, government, civil society, we're able to build sustainable, long-term living solutions. We are leveraging rental subsidies to support young people who may not have income because previous school occlusion, low income, etc. We are working to embed supports within their living environment that help to reduce social isolation, enhance wellness, and support mental health. Most of all, I am aware of my own power and privilege. The story of Tobias is my story. It's my story and my experience of encountering autism. My son, I believe, is fortunate to have the intersection of parental privilege, education, access, and advocacy. He was able to receive a timely diagnosis and early intervention. Moreover, we've been able to bring together a team of speech therapists, occupational therapists, behaviorists to support him in whatever he needs. He is thriving. I am proud of what we've been able to do to support my own child, but I strongly believe that it should not take a position of privilege for everybody else to experience the same thing. So right now, the solutions may not be easy, but it's work that I'll continue to do until all the other little children in Alberta have the same experience as my son. Thank you.